Welcome to the Systems for Dentists training video. My name is David and today I'll be taking you through the treatment elements from within SFD. For the patient's treatment forms, we access the treatment section via the blue chair. From within there we'll see a history of the patient's previous course of treatment. To have a look and see what was done on a course of treatment, I can double click to open the course. Once opened, it will give me a breakdown of what treatment items were on the course of treatment. On this occasion, a clinical exam and 2 x-rays. I can also, however, see this information by selecting history or selecting the treatment history option on the patient's main menu. On this page, it will give me a breakdown of each course of treatment involving who the dentist was, when the course started and finished, and also the items that were involved on each course. This can be printed and you can close from the bottom right. We can access the base chart from the top without opening a course of treatment, but on this occasion we'll go to New and create our new course. On here I can select the performer, the scheme, and if NHS I can select the category of the claim, whether that be routine treatment or urgent treatment, for example. And below I have the patient exemption. Once I'm happy, I can click Save. This will then create our course of treatment. Now the course of treatment is built of these tabs at the top, the first being General. For an NHS course of treatment, this will contain the details of the course, the acceptance, completion, exam and referral dates, the category, which can be changed if set up incorrectly, and the exemption details. To the right you've also got your charge band. It's currently ticked to generate based on the treatment. This means that if I apply an exam, it'll make it a band 1. Apply a filling, it'll make it a band 2. I can however untick generated from treatment to take control of what type of claim I'm sending. This also includes our Reg 11x1 for repairs. We then have our treatment tab, which is where we can do proposed treatment, but we can also do a baseline chart from within there. But then we have our dedicated chart tab. Now on the right we can show the clinical notes. Now for the time being I'm just going to remove them out of the way using that blue arrow. And this will then just show our base chart on screen. Now the way this chart works is we select the item the patient has previously had, select the material, and for a filling we can use a preset surface or we can select the tooth and highlight the surfaces. Using an MO, I can then just click on the tooth to apply that treatment. For a crown, again we select the material and then click on the tooth involved. The treatment which works slightly differently in this view is the bridge. For a bridge I select the tooth, then select the last tooth involved, and it will give me this little box on screen where I can complete the material and the type. We also have little indicators we can put on teeth. For example, a watch, which I can apply to any area of the tooth. Same with a fracture, or to record that the tooth is worn. There's an abscess present, an apicectomy, or that the tooth is impacted. Now for recording the dentition, I can use items such as missing. By selecting missing and then clicking on the tooth, it will remove those teeth from the chart. Another option for dentition is layout. Layout allows us to change the whole chart at once. For example, I can make the upper left C present and record that the 3 is unerupted. A lower left 6, partially erupted. Lower right 4, gap closed. And when I select OK, it changes my chart. Now the option below, movement, that is for a site-specific look into a tooth. If I click on the 4, that will provide me with site 34, the lower left 4 and lower left D. From there, I can show the supernumeraries. and in this case, the lower left 4 plus will mark as present. I can adjust its position, and when I select save, it adds that tooth to the chart. Now properties below, that is how we can see the history of a tooth, but we can also delete any incorrect baseline charting. For example, I can see that this upper left D has been missing, upper left 4 is present, but we've also got the upper left 4 crown. The delete button allows me to remove that, and it takes it back to what it should be. Now the clear button below, that will clear a tooth back to its original state. Be careful when using this because this can remove correct work from the chart. Now the other options we have to the right are to chart a full upper or full lower denture. Same applies for the permanent and permanent lowers, deciduous upper, deciduous lower, and missing upper and missing lower. This allows us to quickly base chart once we've got the patient in the chair for the first time. Also in SFD, charts will load based off patient age. So if we have a child register as a new patient, when they visit the practice for the first time, it'll load a deciduous chart for us. Now the options to the right of that, we've got the deciduous and the permanent stages. On here I can select that the permanent is present and the deciduous is missing, and it'll correct our chart. So that was producing a chart in the Chart tab. As mentioned previously, you can base chart within Treatment tab. To do so, I simply select by left clicking the surfaces, select a condition as sound, and the material as composite. It works in the same way for all treatments. So again, I left click, it's sound, and it's a root filling. And by right clicking, I can record the dentition. So I can record a tooth is missing. Or by clicking on the 3, for example, we've got the properties. Well, as you can see, we can see the history. We've got a notes option, which is how I can add a site-specific note. So for site 23, we've got our tooth-specific note. When saved, this will then display the note icon next to the tooth to indicate that the note is present. It will also apply that note into our patient's clinical notes. Now we can also access that movement screen by clicking in the white space between the tooth and the surfaces to adjust the dentition from there. We can also apply our supernumeraries from that view. In this case, we'll make the upper left C present and the upper left 3 uninterrupted. And now we'll look at adding proposed treatment to our plan. I can do this in the same way as that I did our base chart, by selecting the surfaces, selecting the relevant condition, and then the restoration. Once selected, it will provide our product list. Once added, this will then show on the chart in red. This is to indicate that the treatment is proposed. By clicking on the root of a tooth, I can say the condition is proposed and select the type. And again, select the product and OK. Now another method of adding treatment is by our codes tick box, which is now showing a list of all non-tooth specific treatment. We can search, and we can search by category. And by double clicking on the item, it will add it to the course. Now we can also set up a user quick code list. This is per dentist and can be used for the frequently used treatments. It allows us to select the item from the top to add it to our course. Now the other method of adding treatment in SFD is by code. By selecting by code, you can no longer click to highlight a tooth. Instead, we have a long list of all of our treatment available. Again, we search for an item, and once highlighted, select the tooth to apply. In this case, I select the surfaces. That will add the course to the treatment plan. By double clicking on an item, we can adjust its properties, which includes the tick box for a guaranteed item. Now we can also add items of a different scheme to our treatment course. If I change the scheme to private and go to apply a treatment, it will give me a private product list. When an item has been applied, you'll see it will display the price for that item on screen. By double clicking, we can adjust the price for that item for this patient. Now that we've applied all of our treatment, we can structure them into appointments. By clicking Add Visit on the left, it will add another appointment to your course. And by left clicking and holding on the mouse, you can drag treatments into those appointments. Now that our appointments have been structured, we can double click on the appointment to request it to reception. By ticking the clipboard, entering a duration and performer, and then any additional notes. Once okayed, it will then display clipboard in brackets. That is to indicate that that appointment is now on reception. Now what we'd also want to do is tick complete and charged on the items that we have completed today. We can do that singly, or we can tick the appointment 1 tick box, which will complete and charge every item within that appointment. Now at the top of the form, we have a checkout button. The checkout will refresh the patient's record as a result of any changes made within the course of treatment. It now means that reception can see the charge that they need to take for the patient, and they will also have the appointment information, meaning that we can continue with our patient notes while the patient completes their visit at the practice, makes a payment, and makes their next appointment. Now we'll look at the additional options from within the treatment form. We've got the option of medical at the top. This allows us to update a medical history from within the course. It will give us the option to load the previous assessment, which means it will load the flags based on the patient's previous medical. When selecting yes for a medical question, it will provide the option to add additional information. If the patient has provided that information, enter it and select OK. On the medical, we can also set up conditions. You can tick to say that the patient has none of the below, or select a predetermined condition, or an additional option is if a patient has a condition not listed, we can add it to their medical history. We can provide a warning, whether that be a flag to prompt on the record, or a message to appear on screen when you open the patient record. Now within the medical history, we also have the notes section, which is where I can add any additional notes to the medical history. Once you've completed the medical, it will show with a green tick to indicate that that has been done. Next to it we have the assessment, which is for a patient's social history. This can be completed for the patient by selecting the relevant options. And again, by completing, it will provide a green tick. Next to the assessment, we have the B.P.E. From within the B.P.E, we can look at our B.P.E chart. We can add the values, and by adding a 1, it will automatically add the bleeding mark. To apply bleeding, we just select the bleeding mark. And above bleeding, we have furcation present. Now the B.P.E chart is the only option on this screen that we need to complete in order to save. We do, however, also have plaque score, bleeding, plaque and bone loss percentages. And then we have a few questions about the health of the mouth. We have plaque control, gingival condition, and periodontal status. There's also a notes section below. This allows us to provide any additional notes for the B.P.E. Now when saved, it will put a copy of the B.P.E chart, the questions below, and any additional notes into our patient's clinical notes automatically, and it will also provide it with a green tick. The next on our list is pathology. For a pathology, we can record a full examination or no findings. By selecting full examination, it will ask which user is doing the exam and provide us with an intraoral and extraoral view. To record, we click on the location on the chart, provide the type, a size, and we can also apply additional text. We also have the option of capture at the bottom. This would allow us to take an image if we have a camera linked to the machine, such as an intraoral camera. Once we're happy with the recording, we select save, and that will then display on the chart. By hovering over the icon, you'll see the information provided. By clicking save in the top left, that will then become part of a patient's history. Back in our treatment form, we'll see a green tick to let us know that these have been completed for this course of treatment. We also have the current problems indicator. This allows us to tick an issue a patient is currently having. There is a care pathway, which allows us to record as green, amber and red for the medical history, social history, clinical history, periodontal status and tooth decay. It will then provide us with an automatic score, which we can, however, override should we need to. By selecting override, it will require an override note. Once the note is provided, select OK. This will then display their colour on the care pathway. Next on the list is the estimate. To produce a treatment plan for the patient to sign, we select Estimate, select our template, and this will produce our document, which will include the treatment the patient will receive. From there, we can then print it off for a patient, email it to them, or we can send it to a signature pad or via our Pads Plus service for the patient to sign it on the system. Now again, remember the importance of the checkout button, which is to refresh the patient's record as a result of any changes that you've made. Now on the right of the course of treatment, we have the blue arrow, which allows us to bring the notes into the treatment. You can see here that our B.P.E, our medical being updated, and the treatment completed today has been added to the patient's history automatically. The top box is then for adding new clinical notes. You can type into this box, or you can use templates via the quick text option. By selecting the folder and quick text template by double clicking, that will add it to your top window, allowing you to adjust it for this patient. Once you're happy with the clinical note, select Save, and that will become part of the patient's history. Once saved, you'll see we now have an Edit button available. This allows us to select the note we wish to edit, and once okayed, that will add it to our top window, where we can make any changes. Within the SFD text editor, we can make items of text bold, adjust the size, record it in italics, and also underline to make it stand out. And again, once saved, it will update our clinical note on the patient history. Be aware, however, you can only adjust notes until midnight of the same day. And once you've finished the course for today, select Close. The blue chair is to indicate that the course of treatment is currently still open. and by double clicking I can re-enter the course. Once the patient has attended for their next appointment, we just tick off the items that we've completed until eventually it's all complete. Then to transmit the form, I select transmit at the top. We do have the option of incomplete, but on this occasion the patient has completed all the treatment, so we go to transmit. This will then bring our transmit form, which includes the clinical dataset, the key performance indicators and the tooth assessment. All of these are completed by the course of treatment, but it allows you to adjust and add relevant options such as toothbrushing advice and continuity of care. Once satisfied, select OK. You will then be prompted to select a patient recall. I can see here that the patient already has a recall for the 6th of Feb 2021, but I can set another one for 6 months' time. And once completed, it will close the course down. That treatment form will then be added to a transmission list that will then be bulked and submitted for payment together. Next time the patient returns to the practice, I would create a new course. Also, for selecting a private course of treatment, we can change the scheme. Apply our treatment items as usual. Tick that they've been completed and charged. And instead of a transmit button, we've got the complete button in the top left. Now before we complete the course, we've also got our checkout button. To the right of the checkout, we've got the appointment calendar. This allows us to request an appointment for the future. It gives you the option of selecting the date and which amount of weeks, days, months, which performer, and the reason for the visit. So we can set up a 6-month examination with our dentist from there. Again, that will add to the treatment clipboard on reception. Now to complete the course, we just select complete, and it will also ask us to set a recall. If the patient has a recall and we don't wish to give another one, select cancel. This will then close down the course of treatment. Now that completes stage 1 of this treatment training. In stage 2, we'll be looking at the periodontal and a more in-depth look at the clinical notes.